Hello, everybody. Hi, this is Andrew Lowsutea, President. Hey, this is a real good today that we have some very good topic for everybody. The reason why I put this topic out for lots of different people is because of the fact that we found many of our clients didn't really understand basically what kind of infection they will see, or did they had a habit of formulated a check for themselves to make sure that they will check out every day. So we found that we really need to have some kind of systematic for you to remember what to look at and what are the items you need to check, and also to help you to be better of your manage your diabetic disease. So this lecture was geared for that. On top of that, I found that a lot of people ask me the same questions, say, wow, this is really good if I can understand how I'm going to set up a habit to check myself. And that is really the major reason I set up this webinar, to help everybody better understand. And I think that would be really good, because at the end of the day, we can at least help everybody have a sort of an equal footing to get them to be all set up, okay? And thank you very much. We have people from Hawaii, we have people from Hong Kong, we have people from Philippines, we have people from actually United States, quite a few states, and Singapore, Malaysia, and so forth and so forth. Okay, so I just want to say thank you very much. Hi， 各位朋友，我係 Angela Lowsutea President， 你好。嗱，其實今日我所講嘅節目咧好特別，因為點解咧？好多人咧唔了解我每日要做啲咩 check 先啱咧，同埋因為你知啦，糖尿病係一個細嘅病啦，咁你唔可以話喂，我依家OK 咁啊，但係咧遲啲咧就唔記咗點 check， 咁啊弊家伙啦，咁呢個係一個好大嘅問題嘅，所以咧我哋都希望咧我哋嘅朋友咧，大家都係繼續去管理個糖尿病嘅問題啦，日日點 check 啦。同埋，如果發炎係點知道咩叫發炎咧？咁呢個係我哋今日咧嘅注重嘅目標。咁希望大家學咗之後咧，最緊要每日都 check 下自己先啦。其實 check 嘅時間係 less than 10分鐘嘅，擺5分鐘都得㗎。當你做得好嘅時候，但係好重要，真係要 check。Okay? So today our webinar is really giving an idea of how you're going to check yourself all the time. So that way you can have a systematic, because as you know, diabetic is a lifelong disease. You really got to check yourself all the time, every day, right? So, but anyway, I'm going to get my screens up. So today we're going to talk about the 11th diabetic issue that you guys need to check every day, basically, yeah? And so 今日每日咧就11個項目咧，你每日都要 check 下你糖尿嘅問題。咁我哋亦都了解係咪真係有嗰個問題咧？咁呢個咧就係我哋今日所講嘅東西。OK， 嗱，因為我哋好多糖友咧有北方嚟啊，因為依家都有成20零30個人係我唔係好記得喺邊度嚟嘅，咁我用我幾分鐘嘅時間講，咁啊大家都 update 到啊。So keep to remember, diabetic is a chronic disease. You don't get well. Only thing you can do is control. So it's very important that you gotta basically, to set some kind of control all the time, right? So to do that, basically is very simple. You gotta basically have dieting control. You have to do your exercise. You have to control your blood sugar by measuring your blood sugar. And you have to, in the diet, you cannot eat any white food or eat very limited white food, no soda and juice. Continue to lower your blood sugar. You have to exercise. And pre-diabetic is no different. Important, your A1C for pre-diabetic has to be below 6.4, and you have diabetes already, you can get your A1C actually go as low as below 6.4. And I have a lot of now diabetic patients already saw that is actually can be done, okay? But if you don't take control of the diabetes for pre-diabetic, 3 years, you'll be convert. So you don't want to be in that boat. On top of that, it's important to drink Lowsutea, because when you're pre-diabetic, there are no medication you can take. You can have something to continue to lower your blood sugar so you don't convert. And Lowsutea is probably one of your potential answers to help you continue to lower your blood sugar. Okay? 嗱，各位糖友記住，糖尿病就唔會好嘅。你只係一樣嘢能夠令到你係控制你嘅糖尿病。 咁一定要控制乜嘢啊？你個 A1C 咧，如果你係前期患病，唔可以過6.4啦，繼續幫佢降低5.7啦。如果你糖尿病患者，你就要由高嘅 A1C 一路跌翻去6.4以下，其實係得嘅，因為每個人我見到好多。如果前期患病，如果你3年裏邊冇做嘢咧 ，guess what？ 你就會轉咗糖尿患病者，咁啊唔正仔啦。咁同埋咧，最緊要咧，你喺你個 diet， 你食嘢啦，要 exercise 啦，控制個磅數啦，同埋唔好食嗰啲白粉啦、soda 啊、juice 啊啲唔好食啦。咁同埋咧，或者飲去糖茶個問題，因為咧，如果你糖尿患病者、前期患病者冇藥食嘅，前期冇藥食嘅，咁如果冇藥食嘅時候，你點控制糖咧？未必個得喎。所以飲去糖茶係有呢個幫助。And then I'm going to talk about how diabetic being formed. Everybody go through that. The first stage of diabetes is your LDL cholesterol will go up. And the LDL cholesterol go up will damage your B cells of the insulin. And when you damage these cells insulin, the sad part is the B cell will not take the sugar into the cells. So net result, there are more B cells coming out. However, the thick cholesterol and sugar added up, your blood become real thick. And then the second stage, you're going to form plaque on all your vessels. And this is entire body. Imagine that. Entire body start damaging, starting. And to form this plaque, the second stage, blood pressure is going to go up. And because the plaque is just block up the sugar, the plaque will in the vessel getting less space, so your blood pressure goes up. And then if you don't do anything, the third stage will come. Your A1C will start going up. Your A1C will start from 5.7 and go up to 6.4. And if you don't do anything in 3 years, most likely your 6.4 will change to 6.5 and up. You now become a diabetic. So you become a pre-diabetic range is 5.7 to 6.4. You don't do anything. Fourth stage is you become a diabetic. And everybody go through a similar stage. So keep that in mind, and that's the reason why we're here to give you to learn, help you to prevent that. Now, 各位糖友記住，你有4個 stage 係會 become 係一個糖尿病嘅。第一個 stage 係你嘅LDL 嘅 cholesterol 上去啦，上去之後咧，咁你個損壞你個 B cell 嘅胰島素啦，佢 B cell 唔帶啲糖入去細胞裏邊啦，咁啲糖咧同埋啲LDL 嘅膽固醇咧就會令到啲血好結啦，好結嘅時候咧就變咗好多即係硬塊啦，咁啲硬塊咧弊家伙啦，因為啲硬塊咧就會 block up 咗成身嘅血管喎，咁變咗嚟講你血壓就開始上升啦。如果你繼續唔做嘢，繼續係咁嘅生活嘅，咁你就變咗前期患病者，你嘅 A1C 係 5.7， 但係咧之後咧繼續唔做嘢咧。你 A1C 落去咧就會變咗 6.4 以上咧，咁第4個 stage 就變咗呢個糖尿患病者啦。所以希望你咧唔會嚟呢個 stage 啊，記住喺 A1C 即係喺第3期之後去翻你 normal 就最好啦。OK， 咁其實去糖茶點解㗎？第一，我哋裏邊有2隻，一個叫 guava leaf 咧就會 block 啲糖入去個血管裏邊啦，咁亦都會係啲糖唔入去，啲糖唔會入去血管裏邊。咁仲有啲糖就入咗血管點啊？個 bilirubin 咧就會係將啲糖帶，好似喺 insulin 帶啲糖咧入去細胞裏邊。仲有一樣好處咧，喺個苦瓜咧係抌啲糖由個尿道 cholesterol 啊同埋所以鹽啊掉出嚟。咁所以飲好多人咧冇腳腫嘅。So how Lowsutea work is just only 2 things. One is guava leaves block the sugar into the vessels. And secondly, beta-melon act like an insulin, take the sugar into the cells, like a booster, for example, and they also dump sugar and urine and cholesterol out from the urine. So net result, your total cholesterol, sugar, and salt will come down. So your blood pressure also go down, and also it will help you detox, plus the swell of the body will also go down. Now, if you don't do anything, what's going to happen? The sad part is because it affects the entire body. So potentially you can end up with stroke, you have cataract issue, you have pancreas issue. The worst that 40 to 60% will have heart issue. And nerve damage is a major big thing that most very common now. People start forgetful, don't know what to remember. So you might have grandmother keep asking, so many times, in a short few seconds, for first few minutes, have you eaten dinner yet? And you just don't remember. And then your blood pressure always goes up. You injure because you don't have feel. It might get highly infected. You can end up cutting your foot. Many of diabetes patients actually end up will be has to have dialysis, and 30% of the diabetic patients have no sex life because the sex sexual dysfunction. And then pregnancy, if you're gestation diabetic, you have to watch because maybe a few years later you become diabetic. So all those has to be watched. So you have to be very, very careful. 嗱，如果你乜嘢你唔做嘅話，咁個問題咧就好多問題會出現啦。因為咧你會有中風嘅問題啦，有青光眼嘅問題啦，你胰島素唔 work 同埋你個胰臟會損壞啦，唔出胰島素啦。咁同埋咧40%-60%嘅糖尿病病者有機會咧係會有心臟病。嗱，呢個最大問題係神經損壞啊，即係腦嘅神經損壞。咁你唔記得嘢啦，同埋咧仲有咧好多，尤其是老人家之後咧更加差。仲有呢個叫 Alzheimer disease 又會嚟啦，咁就係仲有高血壓咧，仲有要斬隻腳啦 ，Diabetic Nephropathy 咧，仲有即係要洗腎啦，為30%嘅人係冇咗性功能嘅。咁同埋有陣時咧，有啲懷孕者有個糖尿病之後咧，幾年係有可能有糖尿病嘅，所以呢啲係全部都會喺度，所以要好小心，好小心啊！千祈你唔好以為唔緊要啊，我而家冇乜事㗎，因為將來就會緊要啦。咁其實我哋公司咧有幾樣嘢咧係5個 program 幫助你嘅。So our company have 5 programs to help you holding your hand throughout your diabetic journey. The first thing is certainly we'll teach you how to do lower your blood sugar through dieting, teaching all the stuff about dieting, managing diabetes, and then also drink Lowsutea will be very helpful, especially pre-diabetic patients have no medication. This is something definitely help you. And then you can have exercise program, weight control program. Now we have weekly webinar to update your knowledge, motivate you, and then how to do blood tracking. And all that will helping you to continue to control your blood sugar. Lower your A1C from 10% all the way to 5%. 5% absolutely your normal blood sugar level that you want to achieve. Okay? 我哋嘅節目裏邊咧係有5項咧，捉住你嘅手，帶住你嘅手，同你一路係一世咁行，幫助你咧降低血糖。能夠令到你咧知道咩食咩好啊，點樣做運動好啊，點樣減磅啊，同埋你個聽我哋講書啊，每個禮拜一次啊，每日都係更加知道你血糖係點樣，你度血糖係點樣嘅。咁希望你 A1C 咧由10以上咧跌去 5.7。咁如當你去 A1C 去翻正常人咧，咁你就冇咗頭先所講我哋所有病啦。所以健康血糖水平係我哋嘅中心，幫助你一齊行嘅。Now, so today we're going to talk about, after we caught up, there's a lot of people who come here and a lot of people who might not heard of our program. So this is a good time we can start understand what you're going to do if 11 items, which you need as a diabetes or pre-diabetic even, because you need to start off to get that. So let's talk about that. 今日我講咧，呢個節目咧係11個呢個糖尿病病者有咩注重咧？能夠點樣每日去 monitor 咧，去睇咧測試，睇下自己係咪有咁嘅問題咧？呢個就係今日所講嘅嘢嘅。咁第一so the first one, as you know, diabetes is a lifelong disease. You need to build a habit to manage your daily activities. Now that is the part that what we're trying to do here. That's why a lot of people say, well, a few years ago, I listened to a lecture, but now I forgot all. And that is so common language that I heard from all my clients is that I think I have an idea, but I forgot what was it. Because as you know, one, we're getting old. Secondly, we might not able to capture everything one time, so we have to reinforce that language or whatever education you might have. So you have to continue to learn what need to do. And that's why this kind of webinar will help us so much to continue to build up the information and continue to motivate you to continue to learn and able to help you to be a better managed diabetic patients. And that's what our objective. And that's the reason why you need to start off a habit, okay? So every day after shower, you can be night or day, doesn't matter. You have to check your body from head to toe. ensure that you have no cuts, sores, blister, any other infection. On top of that, especially your high blood sugar level, you have high chances of bacterial growth because your blood sugar will help the infection develop even faster. And on top of that, it slow down your growth, slow down the healing process. So this webinar will help you to identify all that, plus all the things you need to check yourself so you can maintain better blood sugar and better health. 嗱，各位糖友，記住我哋糖尿患病者係一世嘅生活。咁如果你冇一個好嘅習慣，每日 check 咧，你可能唔記得咗。有啲糖友話：我係好似啱啱病嘅時候聽過書嘅，都去聽嗰啲講座啦。有啲淨冇聽講座添，弊啦，因為佢話我聽咗之後我都唔記得咗好多。就算有陣時咧，我哋講咗佢都唔記得。點解咧？因為老人家咧，或者唔係老啦，50零歲都唔係老啊。但係好多時我都唔記得咗啦，係好忙又唔記得。所以希望我哋睇咁多嘢嘅時候咧，我希望繼續咧係繼續了解多啲 ，absorb 多啲，亦都由你方面咧可以解釋多啲人朋友聽。咁我哋咧就做咗我哋工作啦，因為我哋俾我哋其他同學知道，哇，原來咧你可以能夠11點去 check 咧係幫助好大嘅。咁呢個係幫助你嘅。咁今日講 webinar 講啊，喂點去 check 啦？有咩係能夠令到你好似瘡啊、水泡啊，有咩感染啊？因為個問題咧，當你喺糖高嘅時候咧，感染唔會好住嘅，又慢好，但係快 infected， 哇死啦！個點算咧？咁今日咧就講多啲俾你聽啦。So the quick body scan, what do you do? Basically, you have to scan daily a sign of any infection. Now, the more common infections are the infection for the foot, because basically, especially remember we've seen this before, the foot at the bottom, you may have a little, maybe it could be even have a small sore or blister at the back of the foot, have a small blister. These are the most common infection. But that is the infection able to get your foot being chopped off. How bad it is, because I saw it when I was an ICU ER nurse. And a lot of the problem is, especially elderly, you don't maybe not necessarily feel it because you don't feel the pain. And it's not infected, you don't take care of it, especially in COVID. A lot of doctors are not necessarily be readily available for you, then you're going to have an issue. So you got to really have to look at any cut, sore, blister, ingrown toenail, underarm and breast, check your leg and toe, and make sure they don't have any cut and blister. On top of that, you have to keep moisturizing this dry skin, make sure it don't get infected. Because if not, you are in deep trouble to losing your feet, okay? 各位同學，第一樣嘢好重要咧，你真係要 check 下咧。一身嘅 check， 一起身沖涼嘅時候，或者夜晚瞓覺 check 下全身有冇其他嘅起泡啊，或者瘡啊、水泡啊呢咁嘢，或者腳甲嘅問題啊。個原因咧就依啲地方咧就最多機會係發炎嗰啲地方嚟嘅，同埋依啲地方。當有呢啲地方你真係要好注重，因為一發咗炎咧就係一開始咧，如果你唔醫得好咧，真係呢個有機會咧見到。我嘅舊陣時嘅病人咧，俾人斬咗腳，就係原因咁開始啦。所以咧，你真係要小心。咁仲有咧，一定要擺好多潤膚膏落去，整到唔好咁乾啦。咁 make sure 咧，佢真係能夠唔會令到你嘅腳咧會發炎啦。因為乾咧係好容易要發炎嘅，因為個乾咗之後可能 crack 咗之後咧，咁啲微菌入咗去啦，咁就發炎啦。所以一定要 look for 呢啲咁嘅發炎嘅嘅跡象。OK。So remember, make sure moisturizing your foot, make sure it doesn't get too, dry, so it crack and get infected. So that's so important. Now, other common infections usually come for diabetic will be the bladder. In other words, you have bladder infection, and that's very common for women especially. You also have kidney infection, and then the more also common vagina and genital infection. The sad part is a lot of time your genital become very itchy, and because those are fungal growth. A lot of the fungal growth are wonderful because in those areas is always very moist, dark, plus you have the water, sugary urine coming out, then it'll be perfect for them to kind of growing. So you got to watch. Your gum infection is also prominent for diabetes. Sort of feet and skin, everybody know that. But a lot of people don't realize bladder, kidney, those are common infection. I talk to a lot of, diabetes. The bladder infection is a lot of times can be common, can be also very severe. So whenever this infection, you got to be quickly get to your doctor, important, get a treatment, prevent any kind of serious issue. So that is something that you got to really go for it. Okay. 嗱，仲有其他嘅發炎嘅部分咧，就係好似 for example 膀胱發炎咧係好常見㗎，腎臟嘅發炎亦都常見啦，陰道嘅發炎亦都常見啦，生殖器官嘅發炎亦都常見啦，同埋牙齒咧、牙腫啦，咁同埋皮膚同埋腳咧，我哋已經講咗一次啦。當你有呢啲問題嘅時候咧，咁要快脆去揾醫生去醫治，因為遲啲醫治咧可能好難醫啊。咁個時候咧，你咁有好多問題出現啦。咁啊最弊咧，尤其是腳咧有啲細嘅 infection， 你唔醫咧，真係可能你就 end up 冇咗隻腳喎。咁梗係唔想啦，係咪 ？So the first one you have to understand everything. You have to check the whole day, check for all these little stuff. Okay, any kind of infection. So the second thing is you got to spot what symptom of infection you're looking for, and you are looking for very quickly. Now that is really important because symptoms are really able to help you to understand, wow, am I getting sick? One of the early symptoms is fever. Fever could be flu, cold, doesn't matter. You know, COVID-19 is a fever too. But anything you have a 38 degree or anything over 100 or 101, you know you're infected. So you got to be quickly ask doctor to check it out. And on top of that, you have chills, sweating, skin rash, pain, tenderness, red color, swelling, wound cut, it doesn't heal, vaginal, genital, itchy, and you have all that usually most likely is a fungal infection. And then you have pain when you're peeing, could be a bladder infection, and body with bloody, cloudy, and foul-smell urine. That is also a bladder infection. And if you have that, you better go check with the doctor because that is mean that things are coming around the line that you was infection. So these are very quick check because don't delay. Don't say, well, maybe not, maybe I can wait a couple more days because that can be a few days. You can be a total different story. So you need to basically go quickly to check with your doctor and find out what is the problem. Is there any antibiotic can give you to help you to subside your infection? 嗱，各位堂友，我哋好多時咧真係好快脆咧了解，喂有咩發炎咧？咁你就可能夠即快脆咧就去睇醫生。睇醫生嗰度咧，譬如好似發燒，如果你38度以上，即係話你已經有少少發炎啦。咁同埋咧，你就可能要真係食或者抗生素嗰啲嘢啦。尤其是你又會有發冷啊，同埋亦都出汗啊。或者你已經有皮膚皮疹啊，同埋有痛啊，呢度痛或者身體邊度痛啊，又有發炎有腫脹啊，同埋咧仲有咧好多時咧有啲整到嘅皮膚咧唔好喎，咁你一定要快脆去醫治，同埋話要食抗生素啦，同埋仲有好多時暗到咧同生殖器官咧好痕癢啊，呢個咧多數係啲真菌嘅問題啦。嗱，其實咧真菌問題咧。唔係淨係糖尿病有喎，仲有前期患病人都有喎。因為我有幾個朋友咧係前期患病嘅，但係佢已經有真菌嘅喺佢個生殖器官裏邊咧好痕癢，咁佢就要話俾醫生聽，即刻快食要食藥或者搽 cream 啊，去令到佢真菌降低。個原因真菌好多嘅時候，因為你嘅糖尿咧，你嘅尿啊係真係好糖嘅，好多糖啊，咁啲真菌咧就哇開心啦，呢個係真係。好似食buffet咁啊，所以變咗嗰度係容易發炎嘅。咁尤其是咧，你有小便痛啦，或者你小便出嚟嗰啲尿好臭啦，同埋好即係已經係好濁嘅咧，咁嗰啲咧多數你已經係尿道發炎或者你個膀胱發炎啦。咁呢啲係好快 check 到嘅，但係你就快知道，咁就快啲要睇醫生。The third thing is usually what you want to do is you want to make sure you always have footwear easy for you to take care of a diabetes or pre-diabetic patient. because the thing is, make sure you leave shoes at the doorway so you have easy to sleep on rather than go outside the street, go barefooted. Now, that is a real story because one of my clients way back in Hawaii, she just walked out with a bare foot. You know what? She injured her foot. At the end of the day, her foot becomes so infected, and she was almost got her foot being cut. But lucky they were able to save it, but it had a long time infection. That's not cool, man, because she had kind of walked for a long time, a lot of doctor visit, a lot of time. It's only a small little cut, walking outside, just injure a little bit. So you don't want to be in that shoes. On top of that, you have to wear slipper on your shoes when you return home, because the slipper has to have cover your toe. Remember, cover your toe. The reason a lot of time you hit something, you get infected. So your shoes should be wearing a covering. And then on top of that, when you wear shoes, make sure there's no pebbles or stone, because when you step on it, you injure your foot, also will cause you a problem. And on top of that, when you get that injury, maybe it could be a little bit blister that can be converted to an infection. You don't want to be that. So be careful not to get pebble in there. And you have to wear comfortable shoes. And maybe even you change shoes if the shoes are not comfortable. Like, for example, one of my friends, she actually. She's also a pre-diabetic even. But the problem is she already very close to diabetes. So her A1C is already 6.3, going to be 6.4. So even simple that she like to wear shoes a very pointed tip. And she has like not a bunion, but this is the area she got a blister. But it started getting infected because of that. And that pressure, lucky I told her, you don't pop your slip, you don't want to pop your blister. Cover it up, hopefully it continue to go down and let it to be dry and so forth. And she, instead of wearing a pointed shoes, now she wear a very rounded shoes. And net result of that blister go down and help her tremendously. But if you get infected, you can be in trouble. So net result, you get a home remedy, simple as that, changing the shoes helps, okay? So keep that in mind and wear comfortable shoes, make sure that no pressure into your foot. 嗱，各位朋友，我喺屋企出嚟嘅時候，你一定着鞋啦 ，make sure 你鞋即係喺個門口側邊啦，出去就着鞋啦。喺屋企入嚟咧 ，make sure 着拖鞋，拖鞋就有咩啊？要有 cover 嘅拖鞋，唔係話拖鞋咧有即係可以見到腳嘅。因為個腳趾嘅，因為你撞佢整傷咗就弊家伙啦。咁同埋仲有咧，你着啲鞋要好舒服嘅，同埋着鞋入去裏邊咧 ，make sure 冇其他石仔裏邊啊，石仔整親咧，咁有時係發炎噶咯喎，咁變咗又好問題。我有個朋友咧，佢隻鞋咧好尖嘅，好中意着尖鞋，但係個問題咧，佢就喺個腳呢度咧，喺個腳趾公個頂嗰度咧開始即係有個blister，有個 pock 啊。咁我婆話不如你冚住佢，要着啲鞋要好圓頭嘅。咁其實佢唔係好開心嘅女士啊，搞錯咗圓頭，但係好彩佢着咗，咁佢就俾嗰隻腳嗰度咧，佢借咗佢，咁就變咗佢 OK 啦。咁佢唔會有其他嘅發炎啦。So very important, you have to have your shoes, leave the doorway, make sure always wear shoes. Matter of fact, a lot of people actually even wear socks and slipper at home that further protect them. And the fourth thing you have to do is you have to check your sugar daily, because really at the end of the day, you really do not know where you're at if you don't check your daily blood sugar. Now, doctors sometimes request you check your blood sugar every morning, one time. But at the end of the day, some doctor will also ask you to check 2 hours after the meal. The reason is you want to check after the meal to see is your blood sugar has continued to be very high, meaning that if your blood sugar continues 12, 13, even 4 hours later, that's mean your insulin is not doing a job. If your daily continue to be very high, doesn't drop, the doctor might need to add your medication to change that, or you have to drink a lot more Lowsutea to help you to drop the blood sugar down to a more meaningful level, like 6.5, something like that. So you really got to do that. Now, in every morning, your blood sugar should be, if you're pre-diabetic, or it should not be over, should be between 4.4 to 7.2, or 80 milligram to 130 milligram per deal. So it should be in that range. So you got to check, because if you don't check, you don't know where you are at. In 2 hours eating, you should have no more than 10 millimole per liter or 180 milligram per deal. This is the standard. It should be less than that. If you are continue over 240 or whatever, or 14, 15, you gotta monitor a little while, and then if it really doesn't come down, after 2 hours, your blood sugar continue to be high, you gotta talk to your doctor, and maybe you have to drink more Lowsutea to bring it down, and talk to the doctor to get you more medication to bring it down. So 2 items will work together to help you out, because you don't want to continue to get your blood sugar to be very high up there, because that will actually, down the road, it will hurt you than instead of helping you. Okay, so keep that in mind. 各位糖友，好重要咧，其實咧你每日要度糖嘅。如果你唔度糖咧，你都唔知喺邊度。嗱，有啲醫生話朝頭早度一次啦，咁當然度咗啦。咁但係你唔知係食完嘢之後你嘅糖係點喎？咁有啲醫生就話不如咁啦，你2個鐘頭就督一次，即係話你食每一餐即係每日督4次嘅咯。有啲人咧就中意係只係晚黑或者早餐晏晝唔督嘅，但係都好嘅，因為點解都知道你食完嘢之後你個情況係變咗係點樣，所以呢個係一個好重要嘅東西。OK， 嗱，早餐嘅糖咧，之後你係未食嘢之前咧，應該係4.4至到7.2嘅，或者180至130啦，就唔應高過呢個嘅。OK， 2個鐘頭咧，你應該係唔高過10個 millimole per liter 嘅，或者180啦。如果你高過成日高過2個鐘頭，即係就係10、20、30、45咧，唔跌落嚟咧，咁你真係要話俾醫生聽，要知道點去做呢樣嘢，因為嗰個咧計住糖咧係好高嘅，或者你食材要改啦，好多嘢要注重啦，要 find out。嗱，講一個故事俾你聽，我講過啦，我有個老婆74歲，佢嗰陣時又係食叉燒包啊。佢食得叉燒包，佢啲糖就真係16嘅，咁但係唔食嘅時候就改到變翻係7啊、8啊咁，所以你一定要話俾醫生聽，係咪改你食物咧，或者係加藥咧，或者飲多啲去糖茶咧，呢個就要你自己要同醫生繼續傾偈啦。So it's so important if you are diabetic, you have to put a tag to tell people on your bag, on yourself that you are diabetes, because one day you could be suddenly low blood sugar. You can be fainted and people don't know what happened to you. And I can tell you, I have saved a lot of people who are fainted because they came to my ER and I noticed, hey, they have a band and say I'm a diabetic. So I just give them some, glucose or sugar, and right away they wake up real fast. Okay. So this is something you will have. And if you are diabetic, you should have always some kind of candy with you. If your blood sugar is dropped down low, you've got to pop some candy. And I will give you some sign how you can become later on what is a low sugar. Like, for example, you're going to shaking, start getting dizzy, gonna get weak. You better start eating that. But the tag is important because that let people know you are diabetic. So your blood sugar dropped too low. You might need help. You might get fainted. People will know you are diabetic. At least the ambulance driver can help you and whatever. So quickly, you can help you to save you and revive you. 嗱，各位朋友，記住，你一定有個 tag 擺喺個袋度啊，手袋 doesn't matter， 或者手啊。咁呢個 tag 就話俾你，喂，我係糖尿患病者喎。有陣時咧，你知咧，糖尿患病咧，有可能你忽然間係暈咗喺街嘅，唔出奇啊，有好多人見過㗎啦，暈咗喺街。咁其實呢個情況下咧，咁啲人要知啊，原來糖尿病啊，俾或者你係已經好 weak 啦，咁我俾糖你食咗之後咧，你會攞翻啲糖咧，你身體會上翻嚟嘅。咁所以其實咧好重要，你就買個tag 話我係糖尿病啦，或者你又寫個紙喺個即係有個 tag 喺個手袋啊，或者你個身咧，好多人就買個 tag 喺個手嗰度啊，咁 at least 知道你係糖尿病咧，咁係有好大幫助嘅。Okay, then you really need to have some kind of diabetic snack in your bag because of the fact that, as you know, you will potentially at times your blood sugar can go real low, especially if you're insulin users. If you're insulin users, sometimes your blood sugar get very, very low very quickly. And you do need to have some kind of sugar to basically to help you out, okay? So the type of sugar is like 6 units of hard candy or glucose tab in your bag in case your blood sugar drop down to below 3.9 millimole per dil, or it will be 7 milligram per dil or 3.9 millimole per liter. So if you drop down to 3.9, you need to take a tab, or 70, you need to take tab. So it help you put us back up, because if not, you might get dizzy, you might get hungry, you get shaky, you feel funny. And you know, seriously, I see people drop suddenly, boom, on the floor. I saw it before in my ER room. They came in low blood sugar, but they can really drop so fast. They go bing bong and just drop down, and they were total unconscious. And so really, you need to be prepared and help yourself before you got into that stage, okay? Now, a lot of people, unfortunately, they tend to be busy, they skip meal, or they have stress, or they exercise harder, without eating. Those are total affect them, or diabetic, or these diabetes patients will definitely affect them. On top of that, they have diabetic medication like insulin that very quickly lower the blood sugar, which is called hypoglycemia. That becomes a real issue. Now, stress can be a very big issue. Give you a story. This is a real story. When my client, the mother got real sick, and she is taking care of mom. And she got so sick, the mom got so sick, she was so stressful. She also a diabetic, the mom also a diabetic. Net result, couple of occasions, her stress level got her to be so stressed, her blood sugar go real low, she got dizzy. Lucky she had some tab, glucose tab, and able to take right away, help her out. But she didn't realize she can be that stressed. Just stress alone causes her to lower blood sugar so quickly. So that's to save her because she had glucose tabs. 各位糖友，你哋每個糖尿病或者就算前期患病者，好多時咧，你都有少少所謂叫做糖喺度，有一糖啊。糖尿病者一定要有一粒。點解咧？好多時咧，我哋一唔夠糖嘅時候咧，你就會覺得手震啊、肚餓啊，同埋咧暈暈地啊。嗱，依個症狀咧，你要好快脆醫好嘅，因為你低糖啊嘛，低糖你可以吐到暈咗嘅，咁你街暈咗咪家伙啦，冇人識救你。咁你到有手震啊腰嗰時候，你快食粒糖，食粒糖幫助你。咩叫低糖嘅情況咧？係你個血糖咧去到3.9個 millimole per liter， 或者70個 milligram per dil。咁當你有依樣嘅時候咧，你快食粒糖。仲有咧，好多時咧，因為我哋冇食晏晝啦，或者我哋好壓力好大啦，工作壓力啦，或者你做咗好強烈嘅 exercise 啦，或者你冇食到嘢啦，咁呢啲嘢咧，或者你藥物加高咗啦，或者有咗 insulin 啦，胰島素加重咗啦，百樣嘅東西都令你糖降低嘅。當你降低嘅時候咧，你就引致血糖好有個低血糖降低嘅低糖血糖症啦。咁呢個 hypoglycemia， 咁呢樣嘢咧，你係要即刻處理。如果唔係咧，暈咗咧，弊家伙啦。OK， 呢個係危險嘅。OK， 咁變咗嚟講咧，我講個古仔俾咧，好多人就話以為壓力係冇改變嘅糖嘅，唔係，壓力係好大改變。我個朋友咧，佢個媽咪係糖尿病者，佢自己糖尿病者，因為佢媽咪病得好重啊，咁佢自己壓力好大，咁壓力大嘅時候咧，佢有一日就覺得手震暈，好在佢就即刻去食粒糖，如果唔係佢就真係暈喺度嘅。OK。原來壓力係令到你血糖降低好緊要嘅，咁記住係唔好俾你自己嘣一聲瞓咗喺度啊。Okay, so the number 7, you have to continue to try to eat low GI food, okay? Because GI food can able to give you less likely to get low, your blood sugar go up high, like for example, compared to white rice, bread, noodle, and all the other food. So very important. You have to take your blood sugar, you have to take low GI food, okay? That will be very important, okay? And on top of that, will be good to put the low GI food list. And I will give you a list of picture. put on a refrigerator. So every time it will remind you what food to buy. So that way you will not get, so you will always have a meal that looking for low GI food. And then you can remind what the low GI food to eat. The reason is you have to remind it because we are always forget. As we get older, we are forget. So very important. You got to keep asking yourself, oh, what kind of GI food? I want low GI food. What is it? Like eggs, lean meat, all the good stuff. So in the next picture, I'm going to show you the low GI food. Keep that in mind, take a picture, continue to try with that so you will have a system. Remember, take low GI food, okay? 各位朋友，嗱，呢個係個叫呢個食呢個叫做升糖指數低糖嘅食物，升糖指數低食物。嗱，呢個 GI food 咧，其實咧要低 low GI 嘅低 GI 嘅食物。個原因咧就係你 always 食呢啲嘢就唔會令到糖增高啦，同埋擺一個喺個呢個刷喺個雪櫃度啊。咁喺雪櫃嘅時候咧，咁你就可以雪櫃個門嗰度啊。咁你成日買嘢咪記得要食咩叫 GI food 咯。咁變咗嚟講咧係幫助你係記住，因為好多時候老實講，好多時候可能唔記得咁多嘢啦。咁有呢樣嘢係幫助你嘅。So basically you gotta continue to eat your low GI food to help you out. Okay. Now. Then you also need to drink plenty of water. As you know, when you drink a lot of water, including drinking Lowsutea, more water you drink, you keep your skin healthy, and also the water make your sugar lower. Also, more water, and as you drink Lowsutea, definitely help your blood sugar lower. So it also, if you have more water, it helps you to detox, actually help you better for bowel movement. You every day you're supposed to drink 3 liters of water. Okay, so if you become your body are hydrated, your sugar will go lower, and also your bowel movement better. And plus, because you drink a lot of water, you urinate, you will also detox, especially if you drink Lowsutea will actually detox. Okay, so you really, if you have high blood sugar, it actually, your body will actually lose fluid because of high sugar and your skin become very dry. So that is one symptom you will end up. So drinking water, it helps you lower your blood sugar and get your skin to be, very nice and glow, and you feel so much better. Okay. 嗱，每日糖友咧係應該每日飲3公升水嘅。咁3公升水咧，其實我有建議咧飲2公升呢個去糖茶先啦，然後1公升嘅普通水或者飲湯得嘅，呢個水得，仲要3公升水。咁其實點解會飲水好咧？因為當你糖高嘅時候咧，你飲佢會將啲水咧係用咗佢嘅，咁你身體咧就會好乾。當你飲唔夠水乾嘅時候咧，就弊家伙好多症狀出咗嚟啦，好似 for example infection 一樣嘅啦。咁變咗嚟講咧，飲多啲水嘅時候咧，第一，如果你飲2公升嘅去糖茶 ，which 你咪應該飲啦，咁你糖會降低喎。仲有咧，你身體會更加好似將個身體個血液更加好嘅循環啊，啲 skin 個肥膚又唔會乾啊，令到身體特別好嘅。同埋仲有一樣，你去多啲小便。當你小便嘅時候，你點啊？你就排毒咗出嚟啦。仲有你去大便咧，亦都舒暢好多，因為夠水。OK， 嗰啲大便乾好快嘅。And on top of that, you have to also do more exercise, not less than 30 minutes a day and 150 minutes per week. And that's important. The exercise is very important because if you exercise, you use up your excess blood sugar. And on top of that, it actually drives your blood sugar down. And your exercise also decrease your insulin resistance. So that is very good. Plus, that all kind of health benefit. Good for your heart, good for your blood pressure, everything. So important to exercise. Now, you said, I'm so busy, I cannot exercise. Well, it's okay. You split it up. You can get 10-minute walk in the morning or lunch, and then you can walk with your dog after that. And dinner, you can walk another 15 minutes. As long as you add up together 30 minutes. And total in a week, you do 150 miles. I can assure you, you are going to feel much more better. Now, as I said, exercise to help you to decrease insulin resistance and other health benefit. 嗱，各位朋友，每日要 exercise 30分鐘，一個禮拜會150分鐘。咁你話我太忙啦，唔緊要，你分開嚟做啦，10分鐘朝頭早，10分鐘夜晚放狗啊，15分鐘放狗，食完飯之後同大家行下去 shopping mall，行半個鐘頭亦都得嘅。點樣最緊要加埋晒咧？係行最低限度30至40分鐘啦。一個禮拜有150分鐘，你一定對你個糖會好，因為糖咧會降低 exercise 降低咗你嘅血糖嘅胰島素嘅抗拒啦。仲有因為你行咧心會好啦，咁有即係多咗好多你嘅血液循環啊、心臟啊全部好嘅，所以行係好重要嘅。嗱，如果你行咧去99歲你行嘅時候你都行得到咧，哇！你身體一定好健康，所以行係一個人嘅好重要嘅 exercise。Okay, now a lot of people don't think of establish a first aid kit and a kit full of medication and supply for emergency use, especially in a COVID-19 situation. I can tell you a real story, and this is a diabetic friend of mine. Suddenly they said, hey, now you have to go to a quarantine center. And then suddenly they can't go out to do shopping mall anymore. They have to basically leave within a couple hours, pack everything. But for them, in that couple hours, they got so confused. What do I pack? Wow, they got so stressed out. On top of that, they might forget the medication, they forget this, forget that. So important to have that emergency thing in there. On top of that, if you have any injury, you can able to have emergency kit to help you to treat the injury. So these are something you have to have. So for example, if you have a first aid kit, you can prevent any minor injury to become serious injury. And that is diabetic client, everyone should have that. And what would that be is you're going to have, like, for example, you have the wound cleaning items such as hydrogen peroxide, betadine, sterile gas, Band-Aid, all that should be there. So your wound will not get worse. On top of that, if you are actually have nerve damage, you got to be, like, for example, diabetic neuropathy, you need to talk to your doctor because they're going to figure out what can do for you. So if you are diabetes, for sure, all your medication, your supply, blood measure, like picking finger, has to have that ready in the event you got COVID-19, you have to go to a place for quarantine. Don't get stuck there and say, I don't have my medication. I don't have this. I don't have my needles. I don't have my insulin. You got to get that already because in 14 days, you might have no supply or you have limited supply. So you got to be prepared as a diabetes. That is really important. And my friend was telling me while he was quarantined, in the first few days, he was so scared because they don't have to, get everything done. Finally, the government actually give them some stuff, but on the other hand, it's not all the stuff they want. So you got to keep in mind that it can be a potential. Once you isolate it, you can't go out or anywhere you go, you got to have that thing prepared. I think now a lot of places in Philippines, other places also have lockdown. So during the lockdown time, you better have things ready for you. So buy a little extra just in case, okay? 嗱，各位糖友，因為咧你哋真係要做一個咧first aid kit 啊，有個即係呢個叫做緊急包啦，可以講係咪啊？急救包啦嚇。咁急救包係點帶咧？就因為好多時候咧，忽然間你整傷咗，咁整傷咗你一定要快脆咧擺啲藥水裏邊啊，好似 betadine 啊，clean 個 wound 啊。hydrogen peroxide clean 個 wound 啊，同埋喺嗰啲或者 antibiotic cream 啊，要乾淨嘅紗布啊 Band-Aid 啦，呢啲要去 cover 個 wound 啊，呢啲嘢咧係一定要有嘅。如果冇咧就弊家伙啦，因為好多時咧呢啲咧你唔 treat 佢咧，佢真係大發炎都唔出奇嘅喎，係咪？咁所以而家嚟講，你一定要即係有呢啲嘢咧，如果有整傷即刻可以幫你係令到個傷口咧係冚住佢。同埋咧唔會令到佢會發炎，呢個好重要。第二樣嘢，如果你係個 人體你已經神經系統有少少變壞咧，周邊神經係感覺唔到咧，你就要睇醫生，因為可能咧就係因為呢啲咁嘅嘢咧，係要知道點解會咁啦，係咪醫生去同你解答下呢啲？如果有咩即係神經損壞嘅時候，呢啲係你感覺唔到嘅，你就要即係俾醫生睇到係呢樣嘢喎。咁同埋仲有咧，當你有好多時候咧，係你會係如果入咗呢所謂叫冠狀病毒嘅封鎖營裏邊啊，去隔離咧，咁你更加咧係個時間俾你 pack 好短嘅，即係幾個鐘頭，一兩個鐘頭，你又唔可以出去買嘢喎。咁你有兩三個鐘頭 pack 嘅時候咧，你可能會好亂，同埋好多嘢唔記得咗，藥啊、針筒啊，或者係你要日常用嘅糖尿病嘅篤手指嘅東西啊都冇咧，咁你就好弊啦，因為咧嗰間隔離嘅地方未必俾你去買嘢嘅，或者未必俾到你嘅，咁你點算咧？我唔知糖尿幾高喎，係咪？咁所以呢啲嘢咧，要你自己係要處理咗先。咁變咗，如果真係咁嘅情況發生嘅時候咧，你係唔怕忽然間冇晒嘢。咁所以變咗嚟講，一個好重要嘅方案咧，係要開始準備。OK，so do prepare your emergency kit with first aid and also your medication in case you get study lockdown isolation. Okay, last but not least, the 11th point is you gotta take your diabetic medication. And certainly it will be helpful to drink Lowsutea. The reason why you have to drink your take your diabetic medication because you need to prepare your medication, and I highly suggest you have a pill box. And the pill box is basically will give you Monday, Tuesday, Wednesday, Thursday, all the way to Sunday with the morning pill and the evening pill. So you make sure you take the pill day and night or take the insulin day and night. So plus, more important, you have to have a medication checklist. Why I say that is because when we go older, you might not remember what you you might not remember what you say. You might not remember what you have taken. And I can tell you, I have several elderly diabetic clients keep saying that I'm not sure I take my medication double. Okay. And because when they took the medication, they don't check it. And I noticed many of these don't even have a pill box. So they have no pill box. They don't know to take it in the morning and night. So they got mixed up. So you need a system with a pill box so you don't forget you actually took the medication. Plus, do a paper check to say, I took the medication. That way you can track it and help either your children and say, Dad, you take the medication. Okay, all right. So very important, do your pill box and also have a check. And certainly you're supposed to drink 6 to 8 cups of Lowsutea. You can check it too. And you're supposed to use 2 tea bags a day, 1 bag in the morning and lunch, and 1 bag in the evening for the dinner and after dinner drink. And then you're going to drink basically 2 cups per meals. And so it'll help you to decrease the cholesterol and blood sugar. So very important, have to measure and track, make sure that you have done it. If you didn't, you might forget. 第11項好重要，就係你要繼續食你嘅糖尿病嘅藥。個原因咧，當你老啲嘅時候咧，你可能唔記得食藥喎。咁我有個提議咧，就買一個藥盒，係星期1、2、3、4、5、6去到星期日嘅，朝頭早一個，晚黑一個。咁你啲藥咧就擺晒喺度先，你做一次藥嘅時候，咁你食嘅時候，你睇到朝頭早食咗咯喎，晚黑食咗咯喎。咁你都食咗唔會覺得唔記得咗，因為有幾個老人家咧，佢將啲藥就即係喺個醫生攞翻嚟嘅時候咧，就每日去揀啊，哇！好多時咧搞錯晒。咁其實仲有一樣咧，寫張紙，你話我今朝食咗藥就剔，晚黑食就剔。咁如果唔係嘅話咧，個問題咧，你係真係唔記得咗，因為老嘅時候咧，你會好唔記得嘅。當然啦，應該去每一日都飲個去糖茶啦。我講咗就每日飲6至8杯啦，每一杯就250毫升啦，或者8安士啦。 咁同埋每日係飲2包茶啦，1包係朝頭早啦，朝頭早同晏晝啦，1包就晚黑同埋食完飯嗰包啦。咁然後咧飯前飯後飲1杯啦，然後最後咧就食完晚飯後咧再有2杯咧就食完飯飲多杯，然後臨瞓前1個鐘頭前飲多杯。咁你就將你所有全日嘅去糖咧，即係個糖尿咧就好控制，同埋你繼續係食緊藥嘅。咁你唔會食多食少，因為咧如果唔係咧，我冇呢個 habit 咧，第時到老一輩嘅時候咧，你又真係有可能咧唔記得食藥或者食多咗藥。嗱，呢個係常見到㗎啦，因為我有啲老人家，咁我就提議咗買個 pill box 有個丸盒啊，咁佢變咗嚟講就係有一個好大幫助嘅。Okay, so remember using a pill box has a system for you with a check to write down, yes, I ate my medication, can be extremely helpful to help you remember. So in conclusion, as you know, diabetic is a lifelong disease. You don't get well except you can control. In this lifelong disease, you create some habit to daily manage activities, okay? So to manage activities, you have to have total body scan, looking for infection and all the other diabetic issue that you might have. For example, you're gonna have bladder issue, foul urine, and so forth. Those are the things that you have to check, okay, every day. And it takes you maybe 5 minutes, but that's a worthwhile 5 minutes to make sure that you don't get into serious trouble. And then you have to spot all kind of symptom, infection. And then if you have a sore, a blister, it doesn't heal, you better get treatment real quick. Okay, so do not wait because that might end up to losing your feet. On top of that, you should get slippers on the doorway so you can always slip in and you don't get barefooted to go outside. You have to check your blood sugar daily, and you have a tag that will give you a bag to say you're diabetic, so in case, or armband, in case that you fainted, people know who you are, they treat you right away. Diabetic snack in your bag, in other words, you're going to have some snack, for example, some hard candy, you fainted, you can take that, or take low GI food, and then that way you can put it in a refrigerator to remind you. And then you should drink plenty of fluid. You should drink 3 liters a day, 2 liters of Lowsutea, 1 liter of regular fluid, or even soup is okay. So you continue to hydrate it so your skin continue to be moist. Don't dry your skin. And then you also can lower your blood sugar. You should have exercise at least 30 minutes a day or 150 minutes per week that help you out so you can able to increase circulation, burn out your sugar, and it decrease your insulin resistance. Also, you got to establish a sort of first aid kit in case of any injury. You can able to treat yourself right away. Plus, if you get locked down, you have all the medication, everything out there, at least 2 to 3 weeks, prevent you to go out. You have that prepared so you don't get no medication, nothing. And then also, you always have to take a diabetic medication and drink a Lowsutea so you can continue to manage your blood sugar in a good level, continue to maintain your good health. OK， 各位朋友，嗱，記住糖尿病係一生嘅病嚟嘅，係永遠唔好嘅，所以你咧就真係要咧繼續去管理同埋 form 一個習慣。呢個習慣第一，每日咧就要 check 個身體，可能5至10分鐘，但係呢個 check 5至10分鐘好重要，因為你知道咧外面有損，呢度損啊，或者有瘡啊，咁佢唔好咧，我哋好快就揾醫生睇，呢個係好重要嘅。同埋咧，仲有咧，你知道裏面嗰啲發炎有咩嘅問題啊 ？For example， 紅腫瘡啦，或者手好瘀咗紅腫啦，或者係個身體好痕啦，尤其是暗道嘅痕咧，係可能有啲真菌啦，呢啲要好快知道即刻去 treat 啦。咁有時咧喺個門口嗰度咧，啲鞋咧一出街就有對鞋俾你着入去，唔好唔着鞋，因為唔着鞋咧真係可能整親咧就弊家伙啦。喺屋企一定要着拖鞋，同埋咧就每日 check 你血糖啦，血糖咧就應該係即係要唔好過10咧，最緊要唔好過10咧，就係你嗰個食完飯2個鐘頭後，呢個先重要啊！因為咧，如果你過咗10嘅話，成日10咧，即係話你胰島素唔係好 work 啦已經。 咁所以變咗嚟講，你即係快知道醫生話俾你聽，或者飲多啲去糖茶，或者再加藥咧，呢個就另外一個環節。但係知道你個食完有2個鐘係點嘅。仲有你要有個 tag 話俾你話糖尿病者，如果街暈到咧，最低限度咧，我可以話俾你話，原來呢個糖尿病，或者俾糖你食啦。仲要你個袋裏邊有呢個糖尿嘅小食咧，能夠令到譬如忽然間你暈暈地啊、手震啊、想食嘢啊、肚餓啊，就因為啲低糖咧，咁我俾粒糖你食咧，就會處理咗呢個，咁你變咗最低限度唔會暈喺街啦。咁仲有啦，你係要有一個要食啲低升糖嘅食物，一定要 low GI， 因為升糖指數嘅食物咧係尾咧嘣一聲升咗去嘅。慢慢升上去，咁你變咗嚟講咧，你糖咧就繼續好穩定，同埋咧仲有咧，你每日要飲3公升嘅水，3公升水咧最好就飲2公升嘅去糖茶啦，1公升咧就係普通水或者湯都得嘅，冇問題嘅。咁令到你咧就將啲糖啊繼續降低。咁你每日咧就應該要繼續行喺150分鐘，唔係每日啦，每個禮拜行150分鐘，就每日將咧行30分鐘，加埋，就算你係好忙，你都可以能夠分一半段去做不同嘅，有30分鐘，裏邊咧有15分鐘朝頭早行，夜晚行10分都 OK 嘅，但係一定做到呢樣嘢。咁仲有啦，你一定要有個要個叫做緊急包，裏邊有你嘅，如果整傷咗，即刻有好多膠布啊、紗布啊，同埋有clean 你個整你個傷口乾淨嘅藥物啦，同埋仲有咧好重要咧，有晒糖尿病嘅嘅藥物喺裏邊啦，因為好多時咧，你忽然間要俾人韞咗去，譬如隔離，咁你將有晒嘢喺度。咁最後咧要記住，每日都食你嘅糖尿病嘅藥啦，唔好唔記得，最緊要最好有個即係個藥物盒啦。咁你每日都食嘅時候咧，你只係朝頭早食咗，夜晚食咗，再寫張紙我食咗啦。咁呢個咧係一個好重要嘅環節咧，幫助你咧。係唔會加食藥都唔食多咗藥又唔知，食少藥又唔知。呢個係常見老人家嘅。嗱，我講下真實個案俾你聽，有個老人家咧，佢1個禮拜唔記得食藥都唔知，因為佢冇任何嘅 checklist。咁最後咧，佢話爆血管啊！哇，真係好慘啊！因為佢1個禮拜都唔知個高血壓藥冇食到，糖尿藥冇食到，但係唔記得咗啊！即係呢個老人家咁啦嚇。咁邊樣嚟講就一個好大嘅問題嘅，即係呢個係常見嘅。咁我喺 IC 做嘅時候，亦都見到好多呢個病人咁，所以咧一定要有一個好嘅環節咧，係 check 你食咗藥啊，同埋咧係能夠知道你係真係有冇食到啊，咁變咧屋企人亦都幫助你可以知道 ，OK？ 咁今日再講晒啦，咁我就探問下有冇其他問題。Well, today I hope we give you a sort of a checklist, at least 11 items to help you to better learn how to manage a disease. It's so important because of the fact that diabetes is a lifelong disease, we all know. So it will be important that you can follow this and forming a habit. If you have this habit, the chances to get worse is not going to be bad. So I wonder, is there any question from you folks? If you have a question, I can answer, and that would be wonderful. But anyway, while you're thinking about a question, I'll give you one more story. Actually, one of the things that actually also helpful, a lot of people, as you know, government, Hong Kong people also see government doctors. They will give you medication with a name, but many of them don't know what medication to take. And so I would suggest to put a sample pill on the wall. So they said, this is metformin. So that's how the pill look like. And they tape it there. And you take 1 a day or twice a day. So they know what pill they're supposed to take. So they can kind of match the pill with the pill box. The reason why I say that is because as you go older, you're going to start forget what pill you're taking. And with that, at least you have a reference point to do. So make sure that you don't take double or so. So with the reference point, that can be very helpful. And so just some suggestion to help you become, more smart. How do you manage your medication? 各位朋友，因為或者你諗緊問題之前咧，我講個故事啦俾你聽啦。 就係有啲朋友咧係唔記得咗係食咩藥，亦都唔知嗰粒藥係點樣嘅。咁我有個提議咧，就寫咗喺個喺佢貼一粒藥咧。嗱，依個咧就metformin嚟嘅，咁就每日食一粒嘅啫，或者食2粒啦。咁你水藥咧個樣子俾佢睇嘅時候，因為好多糖友咧多數會食有糖尿病藥啦、有血壓藥啦、cholesterol 啊，依3種係多數有噶啦。咁變咗嚟講咧，佢有依3種咧，咁佢知道每日我都要食3種嘅。咁所以變咗嚟講咧，就令到佢更加知道。OK，so really important to really have this type of sort of system for them to remember the type of medication they have. So net result, they will, follow through. So I hope today the webinar can help you to understand what you will have to manage your diabetes. If you have no more questions, I wish you all have a very good weekend, and I thank you very much. Thanks, Edwina. Thank you for your comment. Thanks again. Have a great weekend. I appreciate your participation, and thank you for all the people that from all over the world, from Hong Kong, from Philippines, from United States, Vancouver. Okay. Okay. One other question, GI chat. Okay. Let me load this up for you so you can take a picture. Okay. Hold on. Let me get this out for you. Sorry about that. You want a chart? So let me get that GI. This is GI index chart. Okay. So let me get that for you first. So hold on a second. I'll load it up for you so you can have a GI index. Okay. Hold on a second. Okay, this is a GI index, and I put the English one first, and then you will do the Chinese one. Okay, can everybody see the index? This is the English index. Can you take a picture? This is the GI index. Oh, I will give you this one better, even explain a little better. Okay, you see this picture? GI index. Can everybody take a picture? The GI, sorry. Oh, what happened to it? Okay, hold on. Okay, can you see this picture, GI index? What happened is when you take a high GI index, you're gonna have basically your blood sugar will go up real high, and that result, that is no good. So you guys take a picture. You want low GI index so that don't break the blood sugar high. So this is the thing you do. So this is the kind of food that you want in this area, low GI index. Like for example, I want to have lean pork. I want to have pear. I want to have beans, granola, those kind of food. This is the low and brown rice. These are the low GI index foods. So you got to put that in here. That's what you want to eat. You don't want to eat any of the high, GI index like potatoes. Or white bread or soda, that kind of thing is no good. Or mango fruit or grape is very sweet. So you want to do that. And as you know, when we have food, we should always have half vegetable and one portion is the protein, which is like the egg, lean meat and so forth. And one will be your starch and your low carb food. This is really on a plate. That's what you do, 1/4, and basically that's what we do. So I hope you take a picture, and that will help you to better understand what is high GI in the chart. So make sure to take a picture, and I will take the Chinese one up, and you take a picture English one, and I will put the Chinese one up so you can able to do. Oh, sorry, it's not. Okay, this is the Chinese one. And so can maybe people want to take a picture of the Chinese one, then will be good. This will be something you can take a Chinese picture to do the Again, this is all the low index GI index food, and this is the high GI index foods. Like, so you don't want to take white bread, soda, rice. These are high index, so and it will help you to grow your make your sugars up. 各位同友，你要食嘅嘢咧，高升糖食物咧就唔好食啦，飯啊、白麵包啊、粥啊，呢全部高升糖，因為佢食咗之後升到好高嘅，好快脆。咁你係要食低升糖食物，呢個就低升糖食物，好似呢啲係紅米呢啲同埋有谷嘅麵包啊、瘦肉啊、豆腐啊、蘋果啊，呢啲全部係低升糖指數嘅食物。咁你繼續食呢個，咁你影張相啦，好唔好？So thanks a lot, Gordon. Thank you very much for your question on the GI chat. I appreciate your asking a question. That's very good. I hope you guys get this information. Take a picture, and then you can able to continue to measure yourself with low GI food. Okay. All right. Good. Thank you again. I appreciate time to listen. If there any question, I appreciate ask the question. Very good, you guys. Thank you for your participation. And remember, because I had it on my side, I just clicked it and come up. So I appreciate you reminding me. Thank you again. Thank you. All right, good. I appreciate your time participation. I'll see you next week with another very good topic to help you to better lower your blood sugar and to be better health. Have a nice day now. Goodbye. Have a nice weekend. Good health.